Today we are going to be doing the live. Yeah, sorry if it's kind of dark in right here. So we are live. Welcome, welcome. You're all welcome to my live. You're all welcome to my live. We are going to have a wonderful discussion today. Yes, so please, the noise and everything, let's just manage. We are going to have a wonderful discussion today. The topic, the flyers is all about ampiclos use. A lot of people have used ampiclos for the purpose of they want to prevent pregnancy. I want to tell you what to do, yeah, how to go about it, the real way to prevent pregnancy. Okay, it's not about the use of ampiclos. It's not going to be about the use of ampiclos. Okay, so I want to tell you how it ought to be. Yeah, the right way to use, the right drugs to use, and what ampiclos does, like if it's working. Okay, so I want everybody to join me. Join me. If you are joining me, please don't forget to subscribe to my channel. Like it's happening now. I would have shifted it for backward because I'm so busy, but I can't just disappoint. I've already posted the flyers, I've done everything, so I can't disappoint. So I have to do this one, a quick one. Okay, so that is it. So where are my ampiclos users? Are you there? The question is ampiclos working? Yes, I want people. I know people are going to say yes, it's working. Yes, it's working. Let me agree with you first before we go to disagreement. Yes, ampiclos is working. Okay, for you, it's working. But looking at it, do you know that it's not working? Like ampiclos is not working. Okay, well, one thing I used to tell people is that your belief about a particular drug, your belief about the thing even work faster than any other thing. Okay, so your belief is like the number one thing that you watch out for. Anything you believe on works very well. Okay, so if you believe ampiclos is working, it's working for you, but in reality it's not working. What you are doing is you are abusing the drug. Okay, my dear friends, my fans, I'm as I'm doing life every day, I'm getting to love everybody the more because you just sitting me. Yeah, so please, ampiclos is not working. It's not working. It's your mindset that is making you feel it's working. Okay, so most of the time when you take this ampiclos, bisham ampiclos, and you think that it's working, it's actually you are not ovulating. Yes, that is not your fertile window. That is why you feel that it worked, but it's not your fertile window. Okay, I can say I'm seeing people joining me. You're all welcome. You're all welcome. Okay, let's talk. Please, you can drop any question you have in the comment section. Just be dropping questions. We'll talk. We'll discuss. Okay, I just pray that no call come in to distract our section, even though we are still gonna do a lot. Okay, I'm going to even teach you how to calculate that cycle that your cycle that you have been calculating wrong, because ampiclos is not really working. Okay, don't forget to like as we go on. Please like, subscribe, and follow. Okay, so now let's look at it this way. Ampiclos is antibiotics. Okay, and sperm cell bacteria. Antibiotics are drugs that are used to kill bacterial cells. They either destroy or kill the bacterial cells. Okay, and looking at sperm cells are not bacteria. Sperm cells are living cells that are there to go and fertilize an egg. Okay, so they are not bacteria. So if ampiclos is meant to kill bacteria, how is ampiclos going to kill sperm cells? It does not kill any sperm cell. Okay, so most of the time if you use ampiclos that you feel that is working, is because you are not ovulating, or probably you have one or two. If you know that you are ovulating and you had unprotected sexual intercourse and you went and take ampiclos, probably your hormones, there is something wrong with you. You were not supposed to get pregnant at that period. Okay, let me give you a quick story of myself. This one is of myself. Okay, let me just say it. Okay, it's of myself. Okay, when I first met my husband, when we got married, I was already on antibiotics, ampiclos, to be sincere, to ampiclos. I was on antibiotics. I was treating infection. Okay, so in the process I said I will not get pregnant. Because then when you were still not more educated, like let me say I was still in my year 2 or so. So I don't know much on all these drugs and all those things. This is to be sincere, okay? So I was on ampiclos antibiotics. So I said I will not get pregnant. So in the process now, after I don't need to say, then I found out that I am pregnant. I was like, how come? I was on ampiclos, like not even the worst way that you people even used to take it. People used to take one capsule, and you will just take only one capsule of Bisham ampiclos and the rest will go away. Okay, my own, I was even taking it like morning, afternoon, evening of the ampiclos, because I was treating infection. You get? So in this process of me taking it all those long period, I still got pregnant, and my first son is out there. I gave birth to it's 7 years now. So now, is it that my body, the ampiclos, is not working my body or what? But then, even me, gone, me too, I had the belief that ampiclos works. So what's happened? Are you going to answer this question? What happened? Okay, so welcome everybody joining me. Welcome. So it's not like that the ampiclos is working. The ampiclos cannot kill that sperm cell. So if something, you take it and you feel is working, please, I need you to check yourself. Check yourself. Go and do tests if your hormones are balanced, if everything is balanced. Okay, if you're ovulating well or not. Okay, please don't say ampiclos is doing anything. Ampiclos can never ever kill any sperm cells. Sperm cells are not bacterial cells, okay? So that is the gist. That is the gist. So now my son is 7 years old. He's still this thing. So what is the big deal? Since then, I've removed the belief of ampiclos. So as I get higher and study more to 500 level, finishing university, practicing, I get to know everything that it just the mindset that maybe some things are not balanced. Okay, so now let's talk about what you are doing if you are using ampiclos. If now what is happening is that we are doing susceptibility tests, to know if the ampiclos is working on some persons or not. A lot of girls, even boys, you will notice that ampiclos is resistant, that their body, the bacteria in their body can destroy ampiclos, so ampiclos will not work on their body. Okay, that is what I'm trying to say. So we've noticed that over, and it's affecting our practice, is affecting even you, everybody, because now we are going to be thinking of higher drugs to use. That is why some persons, if it was then now, some persons, if they have infection, now you can say, even you too, if you have, you can just go and buy ampiclos and take morning and evening for a period, then you will know that everything will be gone. But now, go and take that Bisham ampiclos or even the normal ampiclos like that. You will notice that that infection will still be there until you go and treat yourself using higher antibiotics. You go and use expensive antibiotics and treat yourself. That is when you will know that the infection will go away. So that is what we have done. We are doing to that ampiclos, or let me say, that is what you that you are using that ampiclos have done to that ampiclos. Okay, Bisham ampiclos can no longer do its work effectively because it's having antibiotics resistant. Okay, the bacteria are now resisting ampiclos. They are resisting ampiclos a lot. You're all welcome. Okay, so that is what we are doing to, thank God we are back. That is what we are doing to ampiclos. Now, let me tell you why is it that when you take it, you feel you this thing. And it's working. I told you that most persons, a lot of persons don't know when they are ovulating. Like, a lot of persons don't know when they are ovulating. So they don't even know when, if they are supposed to take that drug or not, this ampiclos or not. At the time when they are seeing their at the time when they're having sexual intercourse and they're taking this ampiclos, it might be that you are not ovulating, and you need to ovulate before pregnancy can occur. Okay, and most of the time, if you are the type that that you have unprotected sexual intercourse frequently, like, and you don't want to use CD, you don't want to use CD, please just do family planning. Just do family planning. Okay, family planning, that is the best, so that you will not be seeing your period, you will not be ovulating, and you can be doing whatever you're doing freely. Okay, that is the best. Then let me tell you, if you are not the type that you're having unprotected sexual intercourse frequently, let me tell you some things that you can use, okay, to prevent sexual to prevent pregnancy, rather than going for that Bisham ampiclos that you go and take one capsule. Okay, you are destroying the ampiclos. It's not going to be working well for your body. Okay, so now the best thing you can do is go get Postino 2. Yeah, Postino 2. A lot of people have a lot of say about Postino 2. No, Postino 2 does not do anything to you except you abuse it and you use it this like 3 times in a month. Kilode, what is happening? 3 times in a month, Postino 2. No, now what Postino 2 does is that it changes your cycle. Okay, you have higher chances of seeing your cycle 2 times in a month if you take it like 2 times. Okay, so if you take it, you see your period, you take Postino 2, you are likely to going to see your period again. You take Postino 2 again, you are going to see your period again. And if it happens like that, what is going to do is that is going to stop your it's going to disturb your cycle length. Your cycle length is going to disturb it, okay, thereby making your body not to know when you're exactly ovulating. So if you want to get pregnant now, it will affect you because your body is changing, you're changing your hormone. And those persons that abuse it, like some persons take it like water, those persons that abuse it so much, they end up having issues, hormonal imbalance, and pregnancy will now be a problem to them. Okay, so if you're not the type that you're not abusing it, once in a while that you have unprotected sexual intercourse, just quickly go get your Postino 2 to clear everything out. Okay, Postino 2 is 72 hours, like 2 days after sexual intercourse is still active. Okay, so please just go get it. And if you know that you're not good with drugs, just get unripe pawpaw now. Unripe pawpaw that get it, chew it, eat it, prop, let it flush everything out. That is it. Okay, that is the easiest way. Then there are some drinks that have this chloroquine, this thing. Yeah, but that one is somehow it's not scientifically proven, so I'm not gonna say it right now. Okay, so that is it. You can use that, and easily when you have unprotected sexual intercourse, babe, quickly stand up, go to the bedroom, wash yourself immediately, drink water, wee out, wash yourself. This will help to flush out urinary tract infections and also sperm cells that are inside your body quickly. Don't say you want to relax first. There is no time for relaxation because you are not looking for pregnancy. Okay, if you are looking for pregnancy, you can relax and allow the sperm cell to swim and do whatever they want to do. But if you're not looking for pregnancy, hurry up, go wash yourself, clean up yourself immediately so that you won't be having pregnancy or anything. If someone that is pregnant take Postino 2, nothing is going to happen to the baby. The baby is not going to come down. Nothing is going to happen to the baby. So you see now, Postino 2 is just prevention, is not to do abortion. Okay, so that is it. If you are following me, everybody, welcome. Please like now. Please like now. If you know what I'm saying is wonderful, please like and put down your comments in the comment section. Ask your questions. So I'm not using book. I'm just reversing everything, bringing out things for you. Okay, so please ask questions so that we'll know exactly where you want to know about, and we'll continue. Okay, thank you for the like. Please like and ask questions so that we'll recap everything, because this is life, no book, no nothing. Let's just do it. So now let's go about this ovulation. Okay, I had a book here. I wanted to write this thing. Okay, this thing is not going to show well. I wanted to tell you about your cycle length. Why is it that you don't actually need Postino 2 or any other prevention tips? Okay, if you know that you're not ovulating is like 2 days. Okay, that is like the ovulating day is 1 day, just 1 day that you're going to be ovulating. But 2 days after the ovulation and 3 days before the ovulation, that is going to be like 2, 3, 5, then plus days 6. Okay, let's make it like 7 days you are fertile. Within 7 days period you're fertile. Okay, so you have high chances of getting pregnant. Okay, so if you don't know your ovulate when you're ovulating, how to calculate your ovulation is your cycle length. Do you know your cycle length? Your cycle length is just like, this is the month of September. I started my seeing my period on the 5th of September. On the 5th of September is going to be my day 1. Okay, till November. Okay, till, let me say, if I have short period length, till 28th of September. So if I see my period on the 28th of September again, is going to be my last day. I hope you get. So 5th of September, okay, 5th of September is gonna be 1. Then the 28th of September is gonna be my last day. Okay, so let me say the last now. 5th is 1, 2, 3, 4. I will now start counting from the 5th. It's gonna be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. You will count like that till the 28th. That is the day you're going to stop. Okay, if you count like that and you get that your circle length is let me say 26 days, your circle length is 26 days and you've gotten is 26 days, the next month you counted again and it's 26 days, you've gotten your circle length. Your circle length for the all your period, you know that yeah, you're happy that now you've known your circle length that is 28. Now to know when you're ovulating, you just take your circle length. That circle length is 28, so it's going to be 28 minus 14. Okay, 28 minus 14. Okay, if you say it's the 28 sorry, 26, sorry my dear, 26, we are using 26, sorry for that. Okay, pardon me. So 26 minus 14. Okay, let me do the simple calculation. That is gonna be 12. Okay, that is gonna be 12. So now the day now on the 5th I saw my menstrual cycle. You remember on the 5th I saw my menstrual cycle. So after the 5th, the day I used to see my period, it used to last for 4 days. Okay, so on the 5th, on the 6th, on the 7th, on the 8th, okay, on the 8th I've stopped seeing my period. Okay, I've stopped seeing my period. So now since I've minus 26 minus 14 and I'm getting 12, so now on that 8th that I stopped seeing my period, I'm gonna count on that 8th till the 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Yeah, 20. Because that is gonna be 12 now. Yeah, that is 12. 20. On the 20th is the day of my ovulation. Okay, so if you are getting these things that I'm saying confusing, please drop it in the comment section. And if you want a full video, please drop it in the comment section so that I'm going to bring out a chart and teach you easily. Okay, please like, please like, please like, please like. Okay, so now on the 26th now is my ovulation day. So if 26 is the day that the egg is going to leave my ovary, is going to leave my ovaries and is going to enter my womb, okay, I'm ovulating and I'm seeing all the signs of ovulation, guess what? On the 25th, on the 24th, and on the 23rd, I'm not safe. Then on the 27th and the 28th, I'm not safe. Okay, all those periods I'm not safe. So I can freely, do have unprotected sexual intercourse on the 23rd, 24th, all those periods you can freely have unprotected sexual intercourse. You're not going to get pregnant. Okay, you are not going to get pregnant because you are not ovulating. Okay, if you're scared of getting pregnant, it's ovulation that will cause the pregnancy now, because it's the egg needs to be in the ovaries before sperm can fertilize it. So you're not going to get pregnant. Most of the time that you use this ampiclos and you know that you're not getting pregnant is because you are not ovulating. A lot of persons that use this ampiclos still end up getting pregnant. That is why these days ladies are wise. What they do is that they will buy the ampiclos, they will still end up buying Postinor 2 combined. That is what ladies are doing these days. Now they will buy Ampibisham, Ampiclub. They will still buy Postinor 2 to take. Still, they will still go and take whatever they want to do, just to make sure that it's not. But the most of the time they don't care. They don't know how to check themselves if they are truly ovulating, if they truly need all this plenty gbogbo, if they truly know it, but they don't just care. Most persons don't even know the signs that they are ovulating or not. They don't even know when they are ovulating or not. Okay, actually there are ovulation kits in the market. Okay, there are ovulation kits in the pharmacy. Then you can just use it to check if you are ovulating or not. Okay, that will be a topic for another day. If you want us to do if you want me to teach you how to get the ovulation kit and to even know, teach you how to check if you're ovulating or not, you can also put it down in the comment section. Thank you for everybody. You're joining me. I can see a lot of joining. Please like now, like and comment. Please like and comment. If I'm too fast, tell me I'm too fast. If you're not getting what I'm saying, tell me. If my English is too, now, my dialect have entered my mouth and it's not, sitting you guys, you're not getting there. Say it. If you want me to come to pidgin English, go, let's say it now. I'm going to talk the pidgin English too, okay? But because of some persons that know yeah pidgin English, since you are using English, just comment. Thank you everybody for joining the live. So that is it. It's not that it's working. Bisham ampiclox is antibacterial, is to destroy, inhibit the growth and proliferation of bacteria. Okay, that is what it does. And sperm cell is not bacteria. Sperm cell is life-giving cell, is life-giving. Okay, it's there to bring out forth life. So it's not going to destroy the ampiclox. I've already told you my story, and a lot of persons still come to the pharmacy, still say they took ampiclox, they are still pregnant. That I keep telling them, ampiclox is not the solution. Okay, some persons body are even as stubborn to the point that they will even take posting or two and they will still get pregnant. Those are the people that that they are ovulating, as in they are ovulating, that as the sperm cells just, and the sperm cells, maybe the person that they have the sexual intercourse with is very active, the percentage of activity is very high. Maybe immediately they finish having their sexual intercourse, the thing has already fertilized an egg. Maybe it has already fertilized an egg, and I told you that if you are already pregnant, your postnatal cannot do anything. Yeah, it cannot do anything. So if that person's sperm cell is very active and it has already fertilized an egg, and you say you want to go and start after sexual intercourse, that is when you want to go and take the postnatal, nothing is going to happen. The baby is going to form and you're going to give birth to the baby. Okay, so that is it. Please, if you want me to teach you how to the ovulation, how I calculated it, you don't get it, please, you can put it. Okay, so if you are the type that that you're seeing your period, period, then ovulation is the release of eggs from that ovaries into your fallopian tube. Okay, so in your fallopian tube, please, is your womb. The release of egg from it, if you have seen it before, is just like these hands. Okay, the ovaries will release it into the fallopian tube. It will be there. Then when you have sexual intercourse, immediately, as you have sexual intercourse, if the sperm are moving fast, if that sperm cell is very fast and they are active, they will just go touch the eggs. Any of them that they touch, because it's millions of sperm cells that are there. If they touch two eggs like that, twins like that, so if they touch the eggs, then pregnancy, fertilization have started. The next day fertilization have started. It's not going to start the next month. Fertilization have started. Okay, so now, if now the sperm does not touch that egg, if the sperm is now sluggish, maybe, or sometimes you use CD, you use protection, condoms, and you do not touch that egg, that is when that egg will now, after the 24 hours, just the one day, then that one day of ovulation, that is when the egg will now get upset and break, burst, scatter. Let me use the English, scatter, and the next thing you will start seeing your period. Okay, so the process of the eggs, the scattering and everything, you'll be feeling the pains and everything. The next time your period is out, you're seeing your period, because your body is pushing out everything. And the thing, this our system, it flushes a lot. Okay, so it will now flush it and you will now see it in your pads, in your sanitary towels, that yes, you're seeing your period. Okay, so the process is ovulating. If you're ovulating, no sperm touch it, period. Okay, then after periods, you will wait for some days. The day of your ovulation, you ovulate again. Then it will wait. If sperm touch it, fine, it will grow. If sperm did not touch it, bam, it will burst again and turn to your period again. So that is how the female body is moving around. That is why we call it menstrual cycle length, because it's in a cycle all around. That is why we call it menstrual cycle length. Okay, so I can see that nobody asked any questions so far. I think everybody is getting what I'm saying. Please like, you're all joining me. Please like, please like. Ask me question now so that we'll be talking. I'll be talking. Ask me questions. Say I. Tell me I. Let me see you joining me. Thank you all for joining me. Thank you all. Thank you all. Let's discuss further. So that is it about ovulation and ampiclos. So I've given you reason to believe that ampiclos is not the deal, is not working at all. So if you are using ampiclos and you notice that you know when you're ovulating and you check all your ovulation whatever and you're using ampiclos and you know that you're not getting pregnant, babe, please go and check yourself. Make sure you know your hormones are well balanced enough. You know you're having unprotected sexual intercourse with someone that has been medically deemed fit to be okay, okay to pregnant a lady, and you're not getting pregnant. Go and check yourself. Go and check your hormone. Go and do your test. Something might be wrong. Something is not right. So you go and check yourself immediately. That is all what I can tell you, because if you are a lady that you're fit, you're okay, that you are ovulating well, ampiclos cannot stop the pregnancy. Lie. It does not stop pregnancy, okay? It doesn't prevent it. It's gonna come, okay? So if you know that it stopped, it's either you did not calculate your cycle length well, or it's either something is wrong with your body, okay? So that is it. Then there are other factors too, can be. It might be that the person's sperm is not active enough, okay? There are a lot of men, like, let me say 80%, no, 80 is too much, 80, 60, no, let me say 70%, 70% of men that are having these sperm issues, they are having sperm issues. The sperm quality is poor, motility slow. So please, it might be that sperm is not active enough to fertilize an egg too. Yes, why did I forget at this point now? It might not only be your ampiclos, it might be that person's sperm is not active enough to fertilize an egg, okay? So if it's that either you're not ovulating, or it's either that the person's sperm is not active enough to fertilize yourself, to fertilize your egg, or either you're having hormonal imbalance, or one or two things, okay? So don't be scared of getting pregnant and you run. Sorry about that. And you run, and the only option you want to get is ampiclos. No, don't be scared of getting pregnant like that, okay? You don't know the person that you're having the sexual intercourse with, if the person is even active enough. You don't know, okay? So that is it. It's not all about Bisham ampiclos that has even failed self, babes. Now Bisham ampiclos is not the cocoa now. It's not the cocoa. If you know you are doing it regularly, you are doing it for 1 or 2 business regularly, you're having unprotected sexual intercourse regularly, abeg go and do family planning. Family planning is not for only for people that are this thing married. Family planning is for anybody that don't want child. Go and put it. You will not be ovulating, you will not be seeing your period. Then you'll be good to go. And anytime, if you want to do it for 5 years, you put it for 5 years. You want to do it for 3 years, you do it for 3 years. You want to do it for 1 year, you do it for 1 year. That is the best than destroying ampiclos. Sorry about that. So if you are the type that you know that you're not abusing ampiclos, what is gonna happen is that ampiclos is gonna work so well in your body. Hey, it's gonna work so well in your body that even you too, you'll be surprised, okay? So thank you everybody for joining me. It's gonna work well for your infection, your skin infection, your sexually transmitted infection, your bacterial infection. Ampiclos is gonna work very well if you take it at the right dose, okay? But if you are taking it to prevent pregnancy, it does not work. Why I said it work the first time is because I just want to agree with you first before I start disagreeing, okay? I hope I've been able to convince you. My followers, my lovely beautiful followers, okay? I hope I'll be able to convince you and not to confuse you. You can never be confused in this my channel, because if you drop your question, every question I'm going to answer you. Confuse you that ampiclos, Bisham ampiclos can never and will never prevent or destroy sperm cells. Yeah, it's not going to prevent sperm cells, destroy sperm cells, or it's not going to prevent pregnancy. Okay, thank you for staying tuned. Please don't forget to like. Okay, I will see you next time in my next video, in my next live. I will be teaching you how to use the ovulation test kit. Okay, thank you guys. Love you guys. Thank you everybody for joining my live. It was wonderful. I had a lot of persons joining. Thank you, even though if you don't want to like, I'm not happy, Joe. Just like now, the like will not do anything, just to encourage me, just touch on it, it just to encourage me. Okay, thanks for liking. Okay, we've stayed up to 30 minutes. That is nice. 30 minutes is not bad. We've stayed up to 30 minutes and we've talked and we've discussed. See you next time, guys. Mwah! Love you, everybody. Thank you. Bye. We'll discuss next time. We'll see and we'll gist next time on any health issues. Okay. And also, if I get the ovulation kit, I'm going to teach you how to do it live and direct. Yes, I'll teach you that. Okay. But what sample will I use? You can produce your sample and I will use your sample. Okay. Bye.